Trista. This is my Airway activity. I built a model of the lungs. The pop bottle is my chamber, balloons are my lungs, straws are my bronchi, and the saran wrap is the diaphragm. Currently we are in exhalation, or negative pressure. Pull, the lungs inflate, and that's positive pressure. Negative, exhalation, positive. And in between there is atmospheric pressure. So how does this all relate? Well, questions are as followed. When I provide artificial ventilations, there can be physiological problems pertaining to overinflating the lungs or filling our balloons up way too much. Hyperinflation, barotrauma, and volutrauma are problems that can arise from hyperventilation. Hyperventilation is defined as air that gets trapped within the lungs and it causes them to overinflate, and this lessens the elasticity in the alveoli, which interferes with the expulsion of air from the lungs. So pretty much the air gets trapped in there, can't breathe it out, it's just stuck. Hyperinflation can cause barotrauma and volutrauma. Barotrauma is the manifestation of extra-alveolar air, and this is during mechanical ventilation, and this is due to pressure, so it may rupture the pleural space and is also known as a pneumothorax. The volutrauma is damage to the lungs caused by overdistension by a mechanical ventilator set for excessively high tidal volume. This can cause symptoms similar to that of adult respiratory distress syndrome, such as impaired gas exchange, pulmonary inflammation, and hypoxemia. There are many physiological changes that can occur when inadequate ventilation occurs. This can be due to respirations being way too slow or low, or way too fast and too much air. When respirations are too fast, hyperventilation occurs. Hyperventilation is defined as rapid or deep breathing in excess of the body's needs, usually seen as 18 or more breaths per minute. This can happen with emotional situations, metabolic disorders, medical conditions, environmental factors, or a combination of all of them. They can ultimately result in excessive carbon dioxide elimination or respiratory alkalosis. And this is when the carbon dioxide in the body exceeds its production, also known as hypocapnia. If this happens for too long, it can cause an elevations in the body's pH, causing the brain vessels to constrict, reducing blood flow to the brain, and it can also reduce the levels of available calcium, causing cell membrane instability.